good afternoon, and welcome to CBM Calling. I'm thrilled today to be joined by Tim and Kallie Hutton, Global Field Staff in Bolivia, who live in Cochabamba. Tim and Kallie, welcome.
Thanks for having us.
Glad you're here. You've been on this show before and have shared with us some of the situation in Bolivia and the strict lockdown and how you've been dealing with COVID-19 there. How have things changed? Is it much the same? Is it different? What's going on?
So a portion of the country is still under pretty strict lockdown. Includes things like only being allowed to go out one morning a week, nothing on the weekends. People over 65 or under 18 years of age are never allowed out. And you can't use your private vehicle, no public transportation. So it's all done by foot. That's what our situations looked like up until last week. Just last week in our city and a few other cities, they said they're going to try and relax a little bit. So there's still an evening curfew, but you can go out any day, nothing on the weekends. But people are trying to get back to work through that. But now we're in that transition phase, right? And it's been difficult. And just as the lockdown was coming to a close, or at least opening up a little bit, our numbers have risen quite a bit. So I think of what I've seen in Canada or the US, the numbers are kind of plateauing or coming down even. Here, they're still very much rising. So that's been concerning. Over the weekend, three of the hospitals in Cochabamba, our city, said they were just overwhelmed. They couldn't take more patients and they couldn't provide quality care. And that's been kind of the buzz in the media right now. Everyone's just trying to navigate what this looks like going forward. The government is even toyed with putting us back under tight restriction, but they're trying to avoid that. And it's difficult. People want to be safe, but people want to get back to work. And that's right. The situation. Yeah.
Yeah, because I know a number of people that you would work with and know work and get paid. If they don't work, they're not able to work because of the lockdown. They're not having any income.
And I think quite a few people at some point just had to start breaking the rules, right, out of necessity. And so that also influences how the government changes. They say, if we're going to do this, let's do it well. And they have a lot of strict guidelines. And that's what we're kind of watching for right now, is how people are able to navigate under social distancing versus completely locked away.
Right.
Yeah.
So our team, the church engagement team, as we work with churches here in Canada, we're getting all kinds of questions about ministry in Bolivia. You know, the church in Canada has a long history with the church in Bolivia, and is certainly a love for the Bolivian people and a real keen interest in how they're doing and how God continues to be at work through the church and the ministries we're partnering with. So I thought maybe for the bulk of our conversation today, we could go through sort of a list of some of the projects that people are familiar with and interested in asking questions about. You can just sort of give us an update on where things are. Sound okay?
Sounds good.
All right. So number one, let's talk about the Casa de la Amistad, the Friendship House. Many Canadians have. Oh, go ahead, Kallie.
Sorry.
No, it's okay.
Yeah, it's the schools are still not happening here, and so obviously projects with a bunch of kids can't go on as normal either. And so the staff are really trying to be creative about how they're able to connect with the families, how they're able to support them. One of the things they've been able to do is get donations from a local food bank. And from that, they've put together like food baskets that they're taking out and delivering to the families. And you have to remember that these families are incredibly vulnerable before all of this. And so they continue to be even more pushed into poverty from all of these restrictions and not being able to work. And even at the best of times, a lot of these kids were getting their only meal a day at the casa.
Right.
And so that's been difficult. The psychologist, many of you guys, many who have come to Bolivia, I've met her, Carla, called me after delivering these food baskets just in tears because the kids are underweight, the mothers are struggling, and so they're doing their best to provide physical, emotional, spiritual support, but the situation is real. It's
right.
difficult.
Yeah, I mean, incredibly difficult, but thankful that that ministry continues to serve even when its model has to look very different. But the people are still caring for those vulnerable kids.
It's been nice to see the staff also just provide that relational care. A lot of people are in difficult situations where they've been asked to leave because they can't pay for rent, and so the staff is able to kind of help them work through that. A lot of times, mothers connected to the CASA help each other, and that's really encouraging to see as well, where they've formed a network and they step up and are supporting each other in a form of leadership. So that kind of, it's called the House of Friendship, right? And so it's really living up to its name right now.
Wow. Well, thanks for that. I know another project that is near and dear to the hearts of many Canadians who have visited is the Chagas project, in terms of helping people in those very rural areas protect themselves from this disease. Is there any update on the status of what's going on there?
Yeah, so because things have just opened up a little bit, my hope is that right after this interview, I can take off to the rural area for a couple of days, actually. We have some meetings set up with communities just to see how they're doing, what they would like to see going forward. Obviously, the plan that we had in January might have to shift a little bit. The project's always been very healthcare focused about taking on this Chagas disease, but there's also other components to it, such as agricultural initiatives. And so that might become even more of a focus if we have to transition a little bit in this time. But about 2 or 3 hours ago, I just got word that in Niske, the first case of COVID has come out. So that's a major place where we work. And so now they're saying, well, it's gone on complete lockdown. There's no in or out. So it might change plans. But we also work in another area called like Kallie or Campero. And there's an old road where we might be able to bypass Niske and still get to this area and still have work in those areas. So right now I'm on the phone a lot, just trying to figure it out. Be respectful of what the government's asking us to do, but if it's possible, we'd love to connect with people. In a lot of ways, we're thankful because up until now, none of the areas we have the Chagas program have had any COVID cases. So that's been good for communities. But of course, they're impacted by the restrictions and the quarantine, sometimes not able to get their produce to market. And it's just stressful, like everyone's experiencing, right? So I'm a little excited to get out after all these months of my apartment in the city and see what life's like out there.
Okay, yeah, we'll pray that you can still get to Aquile and see what's going on there. So one of the things that I have been struck by in this is the importance of strong pastoral leadership and theological education, training and equipping pastors to lead is always important, but I think in this strange time, even more so perhaps, to have strong pastoral leaders. How does the seminary in Cochabamba continue to train, develop, support pastors at this time?
Well, like a lot of education institutions across the world, they've shifted online. So for some, it was easier. For others, it's been a steep learning curve, both for students and for profs. So my class was easy enough to shift online because I've taught it online before, but there's still lots of problems with access to internet. So students won't have Wi-Fi, for example, and so they need to use data on their phones. And so to do a Zoom call with Wi-Fi is one thing, but when you're counting every single mega that you're spending, you have to figure out the best way of doing things. Tim's been working with some of the satellite seminaries to figure out different online programs that they can start offering, both in the short term, but also in the long term going forward. I've been working with a student who's doing their thesis right now, actually. And so they're working to begin their defense, but we've had to be creative about how to find resources and how to do research from home without Wi-Fi, with no access to a library. So lots of creative problem solving around there. But it's been hard for some of the students who come from other parts of the country. They're stuck at the seminary. They can't get back home to be with their families. A lot of them haven't been able to work But then they've also been asked to kind of step it up and help out in the churches that they're serving at in different ways. As young people, they're more capable of being able to help out in ways.
Right.
And so it's been hard for them. That's been something that's been on our mind and prayers a lot.
Wow. So what I'm hearing is the regular sort of projects that people are familiar with, the ministry that CBM has been involved with over the years in Bolivia continues. Mission continues. It looks very different. So CASA is still caring for vulnerable children, just in a very different way. The Chagas work is still through the local church trying to promote the health care of those people in those communities. You're just trying to figure out how best to do that. And with these restrictions, the seminary continues to train leaders. It's just shifting online, but also dealing with the challenges that means for the students. But it's encouraging. I think I want people that are watching to really hear that this work that we have committed to and do in partnership with local churches in Bolivia is ongoing. And we're grateful for the way that, I mean, you as field staff, but our partner churches, the way they've adapted and pivoted in this difficult season. I want to talk about the unplanned work as well. So all of the relief programming that we've done. But before I do that, let me just look, there's some people that want to say hello. Estella Ing, who has joined almost every CBM calling, says hello. Ali Wardana, the praxis student, Ali says hi, Tim, Kallie, and Adrian. Harry Gardner says, thank you, Tim and Kallie, for your ministry. Dennis Shearman, our Western rep, but who was field staff in Bolivia, says he feels your pain. Aaron Scott, another praxis student, blessings. Your colleague Brenda Hulk says, good to see you. And Melanie and Luana from the team from Fredericton, who were there in 2019, pass on their greetings. So that's a small representation of your Canadian supporters, friends who are praying and supporting the work in Bolivia. So let's shift the conversation then and talk about so we've talked about the things that were planned and how they've adapted. But on top of all of that, there's just been a need to respond in terms of dealing with the COVID-19 crisis and the need that's imposed. What does our relief work look like that we've been part of in Bolivia?
Yeah, so we've in Bolivia undertaken a pretty big initiative. It's been great because for years you do workshops in the seminary or directly with churches about how to be a missional church, how to think outside of the four walls. And in some ways, this is really, I think, taken those practical lessons into a different area for a lot of people. We've been able to coordinate about 90 churches in 5 different parts of the country to step up and using kind of a criteria, try to identify the most vulnerable people in their neighborhoods. And local churches know who particularly needs help. CBM's provided funding generously to put together some food, and the churches have assembled, purchased that food, and got it out and distributed pretty effectively and slick. So of course there's a cost for that food, but there's a lot of manpower that goes into all of that. And it's been a privilege for us to be a part of it. Again, when you talk about it in theory and then see the church step up, I mentioned earlier that we're not allowed to use private vehicles. There's really tight hours that you can leave your home. So trying to accomplish a big initiative when you have all those extra barriers and yet seeing the church think creatively and again, sometimes the church are the people in government or the people in law enforcement or people in the healthcare profession who have really helped us out. And it's not just been in one city, it's been different areas. And so we've been really blessed to see how the church has moved in that way. I estimate we've probably served over 3,000 people with basic food supplies. So that's been great.
Yeah. I mean, I know you have more to talk about, but that's incredible. 90 churches in 5 regions doing a coordinated response.
Yeah.
That's just a great example of unity and of how to work together as the church. Yeah.
I think there's been a shift in people's heads where they're thinking like, okay, this is for now, but what does it look like in the future, in the next couple of years? What can we be as a church? We don't always need a ton of resources to make this happen. We just need a passion and a vision and a mission, right?
Wow.
The CBM's also been able to partner with the Baptist denomination here to try and support pastors. Particularly, Bill Dick has been working hard on collaborating with the denomination to make sure that pastors who are struggling right now, a lot of people have not been receiving salary, so to get some food support to them. Others have been directly affected in their families by COVID. So trying to cover some of the medical costs for those families has been meaningful. And we've seen already pastors experience that, some even losing family members. So it's been, I think, meaningful to be able to provide some form of practical help and just friendship and counseling as well.
That's great to hear how the church is responding in a very difficult time and being the compassionate hands and feet of Jesus, really. We're hearing that with our partners all over the world, but great to hear what that looks like in Bolivia. And I do want to, if you're watching, make sure to put a plug in for our COVID-19 relief fund. And on our website, cbmin.org, you can donate to that, and it'll go towards things like providing food to thousands of people who are in need in Bolivia. So, Tim and Kallie, in all of these calls that I do with people, I always like to ask at the end, how can we pray for you? How can, because we want the people in Canada, your supporters, to give generously and also to pray diligently for you and for our partners in Bolivia. But help us, how can we specifically be doing that?
Yeah, I think throughout this talk, we've kind of talked about the different ministry partners that we have and how they're working as caregivers right now to people in difficult situations. And that's an emotionally and spiritually draining thing to do. So if our churches in Canada can lift them up in prayer, that would be greatly appreciated. For the seminary students, they're in a difficult situation, but have also stepped up in really encouraging ways. And I think prayer for them and for the young people, the youth who have been able to step into leadership during these times. And we've just been so encouraged by them. And then I think also prayer for the beneficiaries of our projects who, like I said, are incredibly vulnerable to begin with. And this has been an even heavier burden on them. So prayer for them, that they would receive the care that they need and that they would have hope and peace that passes understanding during these times.
Well, thanks so
If
much.
I can add to what I've heard from a lot of Canadian and Bolivian churches is how people want to make the most of this time. They know it's unique, it's challenging. And I find that churches in both locations are asking, how can we make the most of it? What can we be doing differently right now? How can we be the church when we really need to be the church? And so I know that Bolivian Baptists are praying for churches in Canada. And so again, if you could reciprocate and pray for churches right now as they're trying to seek God's direction and His wisdom during a challenging time.
Yeah, absolutely. Thanks so much for sharing, for your ministry, and pass on our greetings to the rest of the team and also to the staff with the partner organizations. It is time to wrap up, but I've really, really enjoyed this conversation. So thanks for sharing all those places that I have been and love, and am thankful to hear how God has continued to work through our partner in Bolivia. And thanks for everything you're doing to support them. And thanks everyone for taking a little bit of time this afternoon to tune in and hear about how God's at work in Bolivia. I trust that it's been an encouragement to you and also maybe a challenge about how you can do likewise and serve in your neighborhood and also support the work that we're doing around the world. Want to just highlight as we wrap up that CBM Calling is back on Wednesday. Reminder, we're on a 3-day-a-week schedule now, Monday, Wednesday, Friday. And on Wednesday, Jennifer Lau will be talking to Cheryl Bear, Dave McCleary, and Das Sydney on the topic of racism in Canada. So It's a really important discussion, and that'll be the same time Wednesday on CBM Calling. So thanks again, Tim and Kallie, and we'll hopefully see you soon.
Take care. Bye.
Bye.